Good evening, ladies and gentlemen. Please pay attention. Tonight, I have the honor and extreme pleasure of introducing Calvin Bluiett, who is a government professor at Cedar Valley College. Now, he's written, if you care to read his introduction here, it's like a section out of Encyclopedia Britannica, so I won't read all of it as Tom would, but I'll give you a précis. So Calvin feels that the Affordable Care Act, although it was a step in the right direction, can be improved and can be built upon. And so, and I won't go into that. I should just say, Calvin, it's all yours. Yeah. Oh yes. Oh yes. Are there any announcements? Sorry, I missed that one. Any announcements? No announcements. Calvin, you're on.
Great. Perfect. Thank you so much. Thank you. You want to keep this over there? Most of us have been aware of the recent since 2009, the debate about the Affordable Health Care Act and the weakness in it. And actually from 2011 until 2016, there were always bills introduced to abolish the Affordable Care Act. And then you don't sit down, I'm going to sit you on the corner.
I'm collecting your meal money. Oh, shoot. Sorry about that.
No problem. We know that in the debate over the law, a great deal of time was spent in coming up with a plan. And one of the things anybody will have to do in healthcare is because you have very, very potent stakeholders, the Hospital Association, the Health Insurance Associations, AMA, and the pharmaceutical companies. Any one of those, as we have seen in the past, can derail a plan. And of course, during the 2010 debates, there were concessions made that satisfied the American Medical Association, Hospital Association, and the Health Insurance Associations. And there were some things dealt with the pharmaceutical companies. That's why they were able to enact a law. That's not perfect, but I think it's a pretty good beginning. So I'm going to look at some of those things and make some recommendation I think will enhance it. My report will focus on why we need to make changes in the Affordable Health Care Act to make it more effective relative to cost, quality, availability, and accessibility of health services to individuals, which reflects that health insurance is a right as opposed to a privilege. If our nation is to be successful in its endeavor, it will need to build on a system which Americans support and believe in. My position is that Medicare and Social Security is such a system. Politicians need to analyze our experience in the health care dilemma of President Carter and Clinton. Carter's problem was within the Democratic Party, where he and Senator Kennedy could not agree on a plan. Carter wanted a phased-in health plan, and Kennedy wanted a complete plan based on the Medicare paradigm. President Clinton didn't recognize the impact of the healthcare stakeholders had in this particular, in enacting this kind of legislation, which was derailed his health insurance, which derailed his health insurance program. President Obama administration was able to enact the Affordable Care Act without one vote from the Republican Party. However, it failed to recognize the Republicans' ability to demonize the act while it was being debated, and after it was enacted. I do not believe that the Republican Party wants a national health care plan, nor have they developed a proposal which is better than the Affordable Care Act. We saw that recently when they tried, the people came out of woodwork who were beginning to benefit it, and they were not offered anything to supply it. The Affordable Care Act is a good beginning. However, additional work is needed now that we have experience in administering the Act. We need to focus on how to make it efficient. Medicare provides an opportunity for both a public and a private system with a proven record of working in our mixed healthcare system. We need to build on the Medicare paradigm. The current discussion relative to how the Affordable Care Act can be improved is the concept of Medicare for all, often which offers the best option. The public option and single-payer system are politically not acceptable to a majority of Americans. My recommendation would be to expand the Medicare to citizens of age 50 to 65 and from birth to age 26. The Affordable Care Act already provides for that. Added Medicare Part E for all other included employer plans and a role for Medicaid. The remaining parts of the bipartisan will provide more details regarding enacting and administering the recommended health care plan. Being a former history teacher, I think Americans, we don't know our own history. And as a result, we repeat things we shouldn't repeat if we knew it. Discussions relative to national health insurance began with President Roosevelt during the Social Security debate. How he pulled the health insurance plan from the debate because he believed it would prevent the enactment of the Social Security program. President Truman wanted to enact the National Health Insurance Program based on the Social Security paradigm, although the political resistance against the proposal didn't permit the legislation to be enacted. President Johnson's administration was able to enact Title 18 and 19, Medicare and Medicaid of the Social Security Act, which covered covered persons age 65 and poor people. The President Carter and Clinton effort to enact national health insurance was not successful, while President Obama was successful. President Obama's success in enacting the Affordable Care Act, however, Democrats ought to learn from the experience and focus on health care priorities that make sense relative to policy and politics and build on popular support over time. The priorities must deal with core concerns about health care, not absorb every last dollar of revenue, which an administration may hope to have to implement a new program. A health care plan focused on repairing what is ever left of the Affordable Care Act. A new Democratic administration should focus on one or two signature health care proposals that advance long-term objectives of universal coverage and cost control and respond to people who have insurance but still face financial stress for medical bills. Two ideas meet these criteria. Making available a new Medicare plan for people 50 to 65, referred to as midlife Medicare, that would place limits on America's excessive health care price. The Affordable Health Care Act hasn't effectively addressed the underlying problem of rising costs, and the consequences has not assured a stable, affordable system which will expand the Affordable Care Act, with a focus on cost containment, cost and health care prices. The Medicaid expansions and reform offer the individual insurance markets ran into problems even before President Trump was elected. Some of the difficulties stem from the Supreme Court's decision making Medicaid expansion optional, while others reflect limitations of the act itself. Thus, the Supreme Court making the Medicaid expansion optional for the states, which is while 19 states have not accepted Medicaid expansion. The states which have accepted Medicaid expansion, results are materially different from the states that do not accept Medicaid expansions. Uncovered residents is 8.8% in those states who accept it. while those without expanded Medicaid benefits is 19%. Therefore, Medicaid may not be the best tool for universal coverage based on affordable health care. Medicare is the best tool to expand universal coverage. The United States devote nearly 18% of national income to health care, compared with 11% for peer nations and 9% for the 35-member nation of the Organization for Economic Cooperation and Development. The biggest factor for the difference is the price of health care in America, particularly for patients with private insurance or no coverage, which is the heart of the problem faced in America. Other nations regulate health care price and budgets. Americans seem to oppose regulations unless it benefits the elite. We seem to believe that market force is the best regulator, which is a myth. Healthcare is not the type of service that are sensitive to the law of supply and demand. Rather, at some point in our lives, we will need healthcare. Thus, healthcare price needs to be regulated. The sources of market failure arise from structure of healthcare and insurance, and from trends towards monopolistic powers, which have made a bad situation worse. Healthcare spending is concentrated among the very sick, and that's a reality that we have learned with the affordable health care. It indicates that 10% of American population account for about 2/3 of the total health care costs. We need to have a system where all Americans are covered and the premium costs will not be onerous on a particular group. Further, we need a good preventive health program, which would have a major impact in preventing or delaying chronic health care diagnoses that are very expensive. Factors that are exacerbating the cost of health costs are provider consolidations. You have large provider organizations that are consolidating, and they can impact the costs and what they charge for health care. Lack of cost and price regulation. Lack of a community rating system for setting premiums for all Americans as opposed to two groups. Let me just expand on that a little bit. There are two systems of setting premium rates. One they call the experience rating system, and they look at the experience of that group, and the premiums will go up based on that experience. An example is the people who are in the Affordable Health Care Act. They are the sickest people, and their premiums go up higher because of the size of that group of people. Insurance requires large numbers. You don't have large numbers, you're going to have problems. That's the experience rating system has been used prior to the Affordable Care Act. And if you were in a small group and one person needed a heart transplant, your premiums went way, way up. And they worked well for teachers in Texas because all the teachers in Texas is one program. That's large numbers, and they have been able to keep their premiums relatively low compared to other groups. The Affordable Health Care Act says it's a community rating system. However, it's by group. If they looked at the North Texas area as a community, that's a large group of people. And that ought to determine how the premium rates are set, not based on an individual or a small group, but on all of the people. And that's what I'm talking about. The Medicare system is not perfect. However, it has kept down Medicare costs when compared to private insurance or physician services. However, not the same impact on hospital services. There's a broad difference between costs in hospitals ranging from 130 to 200%. And so that is not working. Medicare negotiates a rate, but they pay that rate. And I personally experienced that in 2016. I was in the hospital 4 days at Charlton Methodist. 4 days cost $50,000. And every doctor that spoke to me submitted a bill. So Medicare paid the $50,000. They didn't pay what each doctor billed. They cut that materially. And later on in the year, I That was just diagnosis. When they got ready to treat it, I was in the hospital for 13 days. And the hospital bill alone was $107,000. And every physician that spoke to me submitted a bill. Now, if I had not had good health insurance, I would have been bankrupt, just on that. And my wife was with cancer for 8 years and got treatment for it. She probably had $700,000 or $800,000 in charges. If we had not had good health insurance, we would have been homeless. So that's some of the things we need to look at. Healthcare evolution. I'm just talking about how it came about. This is still doing a little bit of history. Medicare and Medicaid was enacted in 1964. And that program faced a lot of pushback. Insurance companies didn't like it, and I had the opportunity to work in that program in 1970 and 1972. And we were placing kind of a representative in each of the carriers and intermediaries that represented the Medicare Bureau. They didn't want nobody over their shoulders. But we were able to turn that into something that was beneficial to both the carrier and intermediaries in the Medicaid program. But it was not popular on the front end. The other program was the Partnership for Health program. These are programs like Maternal and Child Health Program, where the federal government provided grants, almost at 90%, to state and local health departments to carry out and administer those programs. And when President Nixon was president, he actually wanted a national health insurance program. And he took 2 steps that moved us to get ready for it. One was the called Professional Review Organization. This was the first time that physicians in healthcare facilities had to have an internal peer review among peers and an external peer review, which they couldn't manipulate. They pushed back extremely hard against that, but the government stood pat and it became a reality. The second piece was health planning, and all the healthcare providers fought that. But that was to help those provider groups to get ready for national health insurance and to plan so we wouldn't be reacting, that they could be proactive. But they fought that too, and eventually they stopped funding the programs. Now, my experience with the Medicare Bureau, I was a contractor specialist. And Medicare, in some people's minds, it was a single payer. Medicare is not a single payer. We have contracts with carriers and intermediaries like Blue Cross Blue Shield, Equitable, and they pay the claims. We give them the money to pay the claims. Medicare provides the money to pay the claims, and we give them administrative costs. We limit the ratio, so that's about 20%. That's how we reimburse them. But so I was working with that, and then in the public health service, they were the one administering the Partnership for Health programs. And President Nixon wanted to get those organizations, to enable them to develop financial management and billing systems, so that once the National Health Insurance Program was enacted, they could gradually reduce the grants and they could bill for the service. And I was a point person for that. I had to work with them in developing those kinds of systems. But you know what happened to President Nixon, and nothing happened as a result of that. Well, I left the Medicare Bureau because I like policy better than I do administration. Medicare is a very, very complex program, and insurance is very, very complex. And policy is a little different ballgame. So I went with the public health service, so I'd be in policy. And so my job for about 5 years was like a reimbursement specialist and financial reimbursement specialist. Then after that period of time, President Nixon got in trouble. And then I went into health planning. Of all the positions I had in my working career, I liked the health planning better because I could lose my economics and my political science. It didn't mean it was easy. It was what I call a kind of a positive challenge. A positive challenge. And so it challenged me in both of those areas. So that was that. And we came up with a Children's Health Insurance Program. Now we pointed out the Carter-Clinton dilemma. President Carter and Senator Kennedy could not agree, and so nothing happened. They had the votes in the House and the Senate, but because they couldn't agree, nothing happened. President Clinton, he underestimated the power of the stakeholders, and they really defeated his law with this thing they had on television talking about what it was going to do to him, and that was probably, it cost a lot of money to put someone, but it was there all the time, and people saw it, it frightened them, and they pushed back, and it didn't happen. And we've talked about the fact that President Obama's people or administration, they dealt with all the stakeholders, and they got buy-in for it, and we didn't have any pushback from them. But it's not we got to make changes to make the program work, and they're going to have to give up something. So it's going to take a lot of work to do that. And we had major Republican opposition. They opposed the law in the Senate Finance Committee. They were the last to act on it because this chairman of the Senate Finance Committee was from Montana, somewhere up in there. He cooperated with Republicans. He just knew that he was going to. He got one Republican vote, and that was Senator Grasso, whatever his name. And he went out and demonized the program after voting for it. He's the one that added provisions that Congress had to be members of the Affordable Care Act. And so that's what I'm talking about. That kind of opposition, demonized, and much of it was not true, and some of it was partially true. But the Democrats didn't react to it. They didn't react to it. And so actually in 2010, the Democratic people they voted for it. If they didn't like it, they shouldn't have voted for it. They didn't discuss it in the election, and they lost control of the House. If they had pointed out and justified why they voted for it and what it would do for the people, the situation may have been different. But they didn't. They ran away from it, and so that's what part. The Supreme Court made Medicaid expansion optional. Thus, 19 states are not accepting Medicaid expansion. We've already covered that. Republicans' effort to repeal the Affordable Care Act during President Trump's first year of his administration, it failed, but just barely failed. And it was because Senator McCain and Senator College voted with the Democrats. That's why it didn't pass. So potential option. As I've indicated earlier, single payers to replace private health insurances is a no-go for mine because it's misunderstood. It doesn't mean that there's a federal agency, one federal agency paying the claims like they do in Canada and Great Britain, as I understand it. John, you can correct me if I'm wrong. It is working through carriers and intermediaries. And carriers pay the physician services, supply, and physical therapy claims. And the hospital claims are paid by the intermediaries. So that's the way it is, and that's the way the Affordable Care Act is working also. The plan being discussed is synonymous to Medicare. Second, we need a system where government uses bargaining power to restrain healthcare costs. And the hospitals, the monopolistic provider associations, and the pharmaceutical companies, we got to do something about that if we're going to reduce costs. Because just think about it. A large number of people have hypertension. That medication is very high, much higher than it ought to be. The other thing, a great deal of the research goes on in the medical field is done in the National Institute of Health, which we as taxpayers pay for, and they benefit from. And they want to charge huge price that has no relationship to the research costs and the development costs, and if they ever make so we're going to have to deal with that. It's not going to be easy, and there will be trade-offs, and some of the trade-offs may be maybe some people don't want to like it. The real question is why U.S. spending is so high and that we pay such high prices for medical goods, services, and prescription drugs. Now, when the Part D of the Medicare Act was enacted, it made it illegal for Medicare beneficiaries that subscribe to that program to buy pharmacy from Canada, Mexico, or anywhere else. It was illegal for them to buy gap coverage, like a plan that covered their co-insurance. So the plan was for the pharmaceutical companies. It was a great bonanza for them. And for those persons at the bottom of the line who didn't have money and pay for it, those who had the money to pay for it, it wasn't that beneficial for them. The political reality bites. We have an American health insurance culture reflecting a mixed healthcare system, Medicare, Medicaid, and private health insurance. It enriched a whole set of deep pocket stakeholders who are willing to spend whatever it takes to block changes that threaten the status quo. That's what we got to deal with. We're going to talk about doing the things that I've suggested. The solution become the problem. Remember the demonization while the Affordable Care Act was being debated, and which became the problem after it was enacted? However, this should not happen with Medicare for all. The Republicans learned what happens when your health care promise turned out to be unpopular beyond your base. Democrats should not make the same mistake that we did with the Affordable Care Act, with the Medicare for all. The second point I want to make is the case for Medicare. I'm using Democrats because I don't believe Republicans want a plan. They haven't thought about it. And you know, what they tried to do in 2017 indicates they hadn't thought a great deal about it. And they was trying to promise something that was really worse than the Affordable Health Care Act. That's why people push back. Democrats need a better focus on a few issues that relate to a majority of Americans. During the 2016 presidential election, Secretary Clinton had a policy position relative to almost everything confronting the country, but it was on her website. And when people asked her about it, she said, "Go to my website." She should have had a synopsis of what it was, but that's the way she dealt with it. While President Trump focused on a few simple issues, which may have led to him winning the election. Democrats need to focus on the midlife Medicare for persons aged 50 to 65. This would relate to the age group that those 65 and over. You know, there's a connection between age groups. You know, 50 up. The AARP recognizes that. So if you're 50 years old, you can be a member of the AARP. And so they won't have a problem. We try to bring everybody in. It'll be difficult to explain because they think they will be subsidizing those other people, but that's not true. The Medicare would be a new Medicare Part where persons 50 to 60 could buy into the proposal, which would be financed by both premiums and general revenue to subsidize those people at the low income levels, and would fit into the Affordable Care Act as it currently exists. Americans who resist public financed health care in the abstract often seem more willing to support it when the issue is more specific to age. There's a grouping of age people and they have some commonality, and I'm in that group, way in that group in age, but I never thought when we get to health care, we'd be thinking about everybody. Not just what's good for us, but for everybody. And so I think what I'm suggesting is that manifest that philosophy. That is how we got Medicare in children health insurance program. Age-based public programs may not be ideal, but they are not an intolerable compromise. They have the political virtue of creating identifiable groups of beneficiaries whose problem is really readily understood and whose families can be mobilized to defend their rights. How can we achieve Medicare for all? There are different ideas for expanding Medicare, which is now being circulated. A key distinction among them is whether they involve expanding Medicare as a plan or as a program. The distinction is crucial. The Medicare program is not a socialist single payer program, as I've indicated earlier. A third of the beneficiaries use other Medicare programs where they sign up for many private Medicare Advantage plans. And actually, those offer the most benefits at the same cost. Because Medicare used the public program to set the cost they do on physician service and negotiating hospital rates. So that's what it is. Senator Bennett and King have proposed Medicare acts that would be offered as an option in the Affordable Care Individual Marketplace, beginning in 2020, with counties that have one or no private plans, extend later to all individual marketplaces, in the following year to small business. The Medicare Acts plan would meet the Affordable Care requirements for essential health benefits. This is another crucial thing. Many people who have private health insurance have high deductibles and copays and limitations on what they cover. And this is why so many people lose everything if they get real sick. So the essential benefits, so this is a basic plan that nobody can fall below. And it's a plan that would essentially cover your needs. Before the Affordable Health Care, most private plans had capped it at $1 million. And after $1 million, you was on your own. And I've talked with people who had cancer, and they would say that they were blessed because they died just before it reached $1 million cap. That's that top 10%, but they need health care too, just like everybody else. The Affordable Health Care requirement for essential health insurance and be financed through premiums and supported by subsidies as other marketplace plans. The Medicare market is similar to European health system, the market, not the plan, that have multiple insurance funds but more unified payment rates. The other key aspect of Medicare is the dominant role of Medicare's public plan. Public Medicare doesn't just offer an option. Public Medicare costs are based for determining how much beneficiaries pay for Medicare Advantage plans. The Medicare system works as well as it does because it has both a dominant public plan and a price regulation on the private side as far as physicians. Insurers will argue that they cannot compete with Medicare acts under those circumstances, and they are probably right. Insurance needs price regulation to compete with public plans that set rates. The new case for regulations. We argue about regulations, a big struggle. And political leaders need to take a new look at old idea of price regulation in healthcare, stemming from monopolistic practice in healthcare organization consolidation. Politicians need to understand that Medicare has created the basis for a payment system that combines cost containment with incentives for improvement and quality of care provided. Network changes would also be an unpopular idea at a time when deductibles have been rising and patients are being hit by a surprise medical bill. Out-of-network price could be limited in two general ways. Direct regulation based on Medicare rate would be the strongest approach. Commercial rates for hospital care today vary from 130% to 200% of Medicare. Second approach would require hospitals to follow Medicare-related price and post a single figure indicating where they stood in relation to Medicare's effective way to keep costs down. If Democrats get another opportunity to focus on improving the Affordable Care Act, that efforts would have to fit within a larger national agenda and other demands facing the country. The proposal must, for midlife Medicare and price regulation perhaps, will be the best option. What might be both desirable and feasible at that point. Further, we need to consider adopting provider payment caps. These are these large providers that's monopolistic. Lesson from the past. It is difficult to understand why Americans' framework for health insurance looks so different from systems found in other nations. Why do we spend twice as much per person as other nations while leaving tens of millions of people without health insurance and many times more with inadequate protection and worse health outcomes? Americans are distrustful of government because of the politics of government. A lot of Republicans in particular, they talk about government is the enemy. Government is the enemy. And you can say something over and over again, so people believe it. And that's what's happening in this conversation. Americans' fragmented political institutions make transforming public policies hard to enact when they are opposed by powerful interest groups. What should be our strategy to achieve Medicare for all? We need to first do a good analysis of what happened during the debate for affordable health care and what happened after. And we really need to educate the public, not on politics, something that sounds good, but on facts. So people can have some basis to form their opinions. And if we don't do that, we're going to repeat the same. We're going to have the same problem. A community rating system shall be used in setting premiums for all persons rather than groups. Anybody who lives in a community rated area like in North Texas, their premium rate, they buy one or a group or whatever, would be the same rate that everybody has. And that takes care of the large number, because everybody would be there. A single payer system, I've always argued that I don't think it's feasible because it's misunderstood. The government, I don't think the United States will ever pay claims. I don't think so, based on not only the Republicans' ideology, but most Democrats. Public option is not that much. It just says before we had these exchange, that if you didn't have an exchange, the government could go in and set one up. That's what it was. And that's not much more we have. Medicare for all, I think, is the best option. Medicare Part E, which would bring the people from 55 to 60. And we need a program to cover those persons from 27 to 50. And that would be, then when you do that, that would be Medicare for all. But they would have options. They could select an advantage program, if that fit their system, or they could stay in the public program. But they would have the same protection as far as price control. Medicare Part E must have a realistic path to enactment, and it also has to be ambitious enough to inspire supporters and compelling and understandable enough to convince others to become supporters. It has to be grounded in policies that are popular and known to work, that can actually reach universal coverage and restrain healthcare costs and prices. The proceeding must be true during the enactment process and after the law is passed. You can't go home and sit down just because the law is passed. You still got to be involved. We saw what happened to the Democrats who were running for re-election in 2010. They ran away from their own work. And when someone do that, they don't deserve to be re-elected. And that's what happened to them. Further, new Part E will need to be enacted, thus building on the affordable health care. This will require tough thinking about how to build support for these steps over time. Something Democrats haven't exactly excelled at. The Democrats are weak in setting themes and really arguing things. You can't be reactive. You got to be proactive. What you going to do? You can parallel with what the other people are doing so they can see the difference, but it can't be all politics. It's got to be substantially factual, and that's what they haven't done. We haven't done in the past. The Affordable Care Act has failed to generate the kind of middle-class buy-in that has made Medicare so popular and resilient. Thus, advocates will need to permanently improve Medicare for the elderly and disabled, even as they open up the program to the rest of Americans. The two most important upgrades are long overdue: caps on out-of-pocket costs. I have some concern about that, but which Medicare lacks, and direct prescription benefits, those These two upgrades need to be coupled with ongoing strengthening of the Affordable Care Act. Standards for employment-based health plans as well as workers covered by their employers. I think what I'm saying here, the middle class were told that if you had health insurance, you could keep it. But they didn't go a step further and say, but it has to have essential benefits. If it doesn't have essential benefits, you got to get another plan. And so that in itself created some distrust, because later on we corrected that and they thought that we were being deceptive, and I guess it came across it. It must alleviate the belief that they are getting a raw deal. These are other battles, there are other battles that will need to be addressed effectively relative to provider reimbursement, drug manufacturing, and insurers will vigorously fight if any plan threatens their profit and privilege. No country has gotten to universal health insurance without making concessions to private industry stakeholders. One of the virtues of Medicare Part E is that its core components could pursue sequentially if they could be enacted all at once with Medicare upgrades. And Part E could be added to the exchange. Employees could be given the option of buying into the Medicare Part E to cover their workers. At the same time, the standard for private employment-based plans could be raised. Then the penalty under the Affordable Care Act, which doesn't exist anymore, would be irrelevant, because we got everybody in. So that's what the whole thing was, to have everybody in the program. The Affordable Care Act could be transformed to a contributing requirement, first for large employers, then for all employees. The process will need to move through stages before complete replacement of private insurance. These include an expansion of Medicare benefits coverage under Medicare for everyone up to age 26, in measures to allow people of 27 to 49 to buy into Medicare. These provisions reflect the idea that an expanded Medicare program may have to be achieved in steps. The last point is, where should we start? We need to start where insurance ends, where private insurance ends. That's where we begin. We need to have a plan that let people make the choice for a private or a public plan. And they need to have enough education and instruction to know how to make that plan. We develop a plan for integrating Medicaid into the system. I haven't talked about it, but Medicaid is really, with 50 states totals, they cost more than Medicare. It's a larger program, but the bulk of the money doesn't go for health care per se, it goes for nursing home care. That's where most of the money goes. But if we can't get states to buy in, states already are in Medicaid, but in Texas, the thing that bothers me, I really believe the only reason these 19 states didn't buy in is because President Obama was president. I think if someone had been president, they would have been in it, because they have Medicaid already, and they just expanded to those people who earn too much to buy health, to be in the traditional Medicaid program, and don't earn enough to buy health insurance. That's all that's out there. If you have that, you have everybody in the system. Medicaid benefits package and managed care delivery systems are better fit for remaining insurers than is Medicare. They have some programs in Medicaid, maybe better than some of the programs. And I'm gonna give an example. For Medicaid has had a pharmacy program for years. Medicare just got one during the last part of President Bush's first term, and then we came up with what we called the SSI program, something else, and that for Social Security beneficiaries whose income was at the lower level, well, then they will be eligible for Medicaid, and with being eligible for Medicaid, they was also eligible for pharmacy. So these are some kind of programs, and sometimes they have arrangements with providers that may be better on the state level because they have more leverage in those areas. That ends my presentation. Are there questions?
I have a question. Wait for the microphone. Oh, I
She needs speaker.
Ah,
That's a little bit loud. Can we turn that down? Number 3.
Can you see it?
Third
Just turn
down.
it down just a little bit.
Third down.
Number 3.
On the
I don't
left.
think that's on the
On the
left.
left.
On the left. On the left.
Third down.
oh, there's 3 here.
Down. There we go. A little bit more. A little bit more. Up, up, up. We need more.
How about a little testing?
There we go. That's good.
Good.
Yes, there we
Okay.
go. Okay. All right. Where are we going?
The person was over here.
First question.
Okay.
I have a question, Calvin.
Yes.
I understand why those who have vested interests have opposition to the ACA and all these other programs. But my question is, why does the Right and File American have an opposition to making available health care for his or her fellow citizens?
Well, my position, I try to deal with that a little bit, is, you know, we have some greed, and there are divisions between working class people and middle class people and middle class people and the elite. And we have these kind of things, and so there are large group of people who are near the difference between middle class and lower class, and they think like the other people that they ought to be able to have access to something other people. But I think the real problem is they don't have the facts. Now, all of the rhetoric and iteration coming out of the Republican Party during the debate for Affordable Care Act and after was mostly untrue, and partially it was deceptive. But they punched on those issues that, you know, said the government is your enemy, and they just felt that it wasn't going to be right. And evidence of that is when the Republicans tried to repeal and replace it, they were 2 votes short, because there was all across the nation pushback, because they were taking something away from them and not giving them something of equal value. So I think that shows you it's possible if you give people the right information. I really believe a majority of people make the right decision. And we need to know healthcare is not it's a service, not a product. And at some time we all would need it. And we do need to do more in the preventive area, because a lot of I think we have a lot of obesity. And that's going to be critical in adding to our healthcare costs. And if people had something in preventive health, I think high blood pressure comes from anxiety. And when I was in the working world, there was a great deal in the working world to create anxiety because of instability and fear that what's going to happen to you, like what's going on in heavy manufacturing industry that paid good salaries, and now the reality has come is those jobs are gone, they're never coming back. And I think that's the problem. As I indicated, the Democrats, they didn't support what they had done. And so it was no acceptable rebuttal. And so they believed what they heard over and over and over and over to be the truth.
I've been a nurse for 35 years, cardiac nurse. I now work in a
Speak in
community
the mic,
hospital.
please.
Oh, I've been a nurse, a cardiac nurse for 35 years. Is that better? And now I work in a community hospital in Fort Worth. And ever since this Affordable Care Act came along, my question is, does the government follow up on knowing what's going on? Because this act, these indigent people, we used to give them JPS connections, which is not an insurance, but we do a tier depending on how much they make on their income. They can no longer get that until they apply for this Affordable Care Act. Once they do, and they're accepted, now a lot of them are denied, because we're getting a lot of illegals coming across the border, coming to the clinic. But when these people get accepted and they can't afford it, they'll pay 1 or 2 premiums to show JPS that they tried, but they can't do it. So they're going around the system, which was put in effect years ago. And as a nurse, I'm sitting here watching these indigent people can't even get care, can't get what they need, because the system isn't working. they'll make 2 premiums and that's it. They go to the financial department, apply for JPS connections, depending on what tier. We got 1, 1 and 2. Depending on how much they may pay $25 to go to the clinic to see the cardiologist. And of course, the cardiology bill is different, but they never get billed. You know, we eat that up. But that's not fair to the hospital, that's not fair to the nurses, it's not fair to the indigent people, because they're going around it. The illegals that are coming across the border, they need a heart cath or a bypass. They can't get it, so we tell them, go to the emergency room. Now legally, we're not supposed to say that, but go to the emergency room with the complaint of chest pain, and we tell them how it's gonna go down, and they will do the heart cath. We eat it up, we eat that finance. And on Medicare's all screwed up because we're giving Medicare to the refugees. You know, we're getting a lot of people from Africa, from Syria, all of that. And so, like I have a disabled grandchild. Her benefits have been cut because that money has to go to the refugees. The American people come first, but there's got to be a better plan. But the government, that's why I don't like the government, and I'm ex-military, I don't like them because they say one thing, do one thing, but they don't follow up. They don't see what's going on.
Yes, question is, you're asking a question.
I'm sorry. I just want to know what the government's going to do about this.
Okay, you're talking about your experience in Texas, is that right?
Yes.
Texas is one of the 19 states that did not accept a Medicaid expansion, and that's part of the problem. That's part of the problem. The other thing is, the federal government works through other organizations. The federal government don't do anything hardly by itself, except the Internal Revenue Services is run by the federal government. Most other programs, they're contractors. And
No question.
I know I'm not carrying on one of the things you said, but Medicare people, health service providers were not supposed to ask the question, are you here legally? And that's why a lot of those people get in there. But it's something wrong if they can get care and American citizens can't. And I think that can be fixed. And I didn't specifically mention that, but I'm saying if we have everybody in there, we have a good track. People are getting accustomed, like in Dallas, they go to Parkland. In Parkland, what they call community health centers out in the community, so they would go there instead of the emergency room. But you got to have a really good education program to convince them that it's better for them to go to the community health center right there in their community than to go down to Parkland and wait all day. So the problem is the individuals are not getting the information they need to make a viable decision. But the biggest problem is because we don't have a Medicaid expansion. So they come in, it's kind of like on their ability to pay, and then they may not even know how to select the best plan. And I don't know the people who are doing it. So that's what I think would need to be done. And in my perception, that has to be done. That has to be done. And there has to be a system to do it.
I have 2 facts. I think they're correct.
Speak in the mic, please.
I have two facts. I think they're correct. I'd just like you to comment on them. The third leading cause of death in the United States is medical errors. And I verified that on Google not too long ago. And on this, and Jennifer Daniels is a doctor she writes, and she said that Hispanic immigrants come to this country that have no access from Mexico. Hispanic immigrants coming to this country that have no access to medical care live 8 years longer than the average American. So my question
Explain
is,
that last statement, because I'm not sure. You said
this, according to this particular doctor, she said the demographic of Hispanics coming to this country live 8 years longer than the average American, and they have no access to health care. So if we, perhaps you don't agree with that, maybe I'm wrong, but I know my sources. Could you comment on that?
I don't know The stats that I read doesn't really support it, but you know, you can read what you want to read. And I may be reading what I want to read. But I try to look at it objectively. And, you know, an example is they have some type of clinical trials they have people that give something, I don't got the name of it, but it's not really a drug. And they have others that give the prescription. And the outcomes are about the same, so that may have some validity to what you indicated. In Mexico, I think they have more access to preventive health care than we have, because basically what we're doing in preventive care is immunization. And that's good, and we have a pushback on some of that. That may be possible because if we had good preventive care, even if you were, like I'm in a group that's because being an African American, we have a strong potential to be diagnosed with high blood pressure, diabetic, but it's growing to everybody now. And it's primarily because we don't have no preventive care. I believe, I'm not a physician, that anxiety is a greater cause of people who have high blood pressure and diabetes and no exercise. And again, I pointed out things that I've exhibited. I was taking a pill almost every hour in the 1970s, and I wasn't exercising. And I started exercising, I didn't need the medicine. And I think that's what's happening, and you got to convince people that if you want to live here and be fairly comfortable, you need to eat right, you need to exercise, you need to manage your stress.
Okay, since the Affordable Care Act was implemented in 2009, I believe.
2010.
Since 2010, one hospital has gone out of business every month since that time, due to the very reasons this lady back here was mentioning. Hospitals have to eat costs by law because they're required not to do things that are necessary from a business sense to pay their bills. So they can't pay their bills and they go out of business, and that's been happening to hospitals about one a month since 2010. How is that supposed to help people stay healthy?
Well, my stats doesn't support that. I mean, there's a reason. If you're in Texas, if you don't have a Medicaid expansion, then the individual goes in on the on the ability to pay, and they have to pay something, and then they may not have the right instruction to get in to know what choice to make in selecting policies. I know there's been a gap in those kind of services because there hadn't been the money to hire, and we can't get volunteers to do all of that. The other thing, the Affordable Care Act should have helped, and I talked to people at Parkland, and I've talked to people at John Peter Sleep in Fort Worth. They want the Affordable Care Act because it helps them. They can bill for those people that are covered, but since Texas is not in the program, that may be added to it. Hospitals been going bankrupt for a long time.
This is all over the country.
Well, it maybe is the same reason. You need to look at, I don't know if anyone has done any research since that law has been enacted in those states that have the Medicaid expansion, which is all of them except 19. I would bet you that the outcomes are different. Hospitals sometimes operate inefficient themselves. And the only thing that they would, Affordable Care has to help them in those states where they have the Medicaid expansion, but not necessarily in Texas or in other states like that.
When they go out of business, they can't take care of people.
Well, if they go out of business, sometimes it's because they are not being efficient.
Well,
my point is, the Affordable Care.
Month? One hospital every month? You think that many hospitals?
Well, it didn't just start when the Affordable Care Act. It started longer.
It did.
Well, that's
in
not true.
2010.
That is not true.
I just looked up.
Well, you can look up anything. That people support anything you want, and I know that.
The data is there.
Well,
This is question and answer period.
okay.
Calvin, several people have been talking about, I think Tom Fitton from Judicial Watch and some other groups have been talking about the fact that there was some very creative bookkeeping being done with Obamacare, or Affordable Care Act, where they were borrowing billions of dollars over from Fannie Mae and Freddie Freddie Mac, to shore it up, and that there are lawsuits and so forth going on. Are you aware of that?
I'm not.
Hello, Calvin.
Hello, Hank.
You said that I don't understand single payer, and you're right. And you said we don't understand it, but what is it? Make it more clear, please.
Well, I'm saying a single payer would be something like Canada has in Great Britain. We don't have that in the United States. Medicare, individual carriers, we determine the reimbursement principle.
You said that's not what our single payer would be. You said
But that's what everybody is focusing on, is the single payers, the experience they have in Canada and in Great Britain.
What's the other one? What other kind of single payer is there?
Well, I think what they're talking about is Medicare has it's the program. I had, have some complaints, but it's administered pretty good. The carrier intermediaries pay the claims, and they'll come up with DRGs to try to deal with prices. That's how they go and negotiate a rate with hospital. They're just saying a program where everybody is covered by Medicare. That doesn't mean the federal government is going to pay claims. So single payer would be if the federal government passed a law that they pay all the claims, that it pays all the claims.
That's what everybody thought. You said that. I thought you said that's not what.
That's not what Medicare is.
Can I ask one more really quick? What's the difference between Medicaid and Medicare?
Medicare is a total federal program. Medicaid is a program that's funded by both the federal and the state government.
Medicare is for retired.
Yeah, 65 and over, until you 65 and over.
Based on poorness.
On poverty, your ability to pay, yeah.
Okay, Calvin, I have a question. What funds the monies that the Affordable Care Act accesses?
It's appropriated by Congress.
It's appropriated what?
By Congress.
By
That's
Congress.
all the money. That's all the money they have to spend.
So, in other words, the only money Congress has is the money that we give them.
That's true.
So what we're really talking about in this whole thing is we're talking about a loop that's kind of coming back on itself, where we're paying for health care one way or the other, front, back, sideways. Is that correct?
Absolutely. Let me just expand a little bit, because we may be talking about something different. That's why I repeated several times that we spend twice already what anybody else do per person for health care. But our health care outcomes in the aggregate is like, somewhat of undeveloped nation because of all of the issues that we have here, maternal child health problems and things of that nature. So I'm saying that is true. It's not that because we all have a health insurance policy or that we all are part of Medicare and Medicaid, but we have to pay. Now, I know about emergency rooms. When I go to Charlton Methodist and keep my wife there, or to Methodist General, $3,000. That's expensive health care, and somebody has to pay. Those two hospitals are not paying it because they're not they get some charity money from the federal government, but not a great deal. What they'll do is you don't have health insurance, and they will stabilize you and discharge you. And then you go to Parkland, John Peter Smith. And so even the service that those hospitals are paying, the citizens of Dallas County, they don't want to pay more money for Parkland. But we do indirectly because it's paid for. Because if it wasn't, they would have to lay off a lot of people. They couldn't pay the people. We couldn't build a big hospital like it's been built in Dallas County. You're correct. It's spread to everybody in the taxes we pay, but we owe $20 trillion, so we're not paying as we go. But we're going to pay more because we pay interest plus that.
When I was in the Red Cross and I took people to Parkland, they were all overweight most of them had diabetes. And as long as they could go to the doctor, they really didn't care about taking care of their health. I don't know what more do you think we can do to emphasize that. We have a diabetes serious problem right now in this country, and obesity.
I think I understand what your question is. It's a lot of people just, okay, I'm sorry. People, when they get something hurt them, they want to see a doctor. And they go see a doctor, and I guess they get some feeling of it. I have a lady that my wife used to hire to do general cleaning, and I let her still do it. And she was telling about a friend of hers that goes somewhere where, you know, they have, you know, touching and all that, and she comes back feeling better. And I think that's why. What I'm saying is education. Most of what we do and what poverty people, I've never been poor, but I have some sensitivity to poverty. We didn't live like we weren't poor, but we were not poor. And it goes back to other generations, from my great-grandparents on. But if you grow up in a really, truly poverty home, or if you've been generation after generation on income support, then your culture is different. And they need more assistance in how to make decisions about diet, about stress, about, oh, if you can do it. To me, I've always argued that long before I became a professional, that the people on welfare, most of us in public housing, they should have been trained to be daycare workers, and so those people who were not doing the daycare could get a job and be trained for a job. In OEO, we tried programs, pilot projects, but they were locked into those programs. They didn't trust it. And whenever you change a behavior, it takes a great deal of effort. And we're not putting the effort to make that change. Yes?
Calvin, you probably have seen this I would think you might have seen this kind of thing. Is it not true that a lot of times a poor mother or poor father will assuage the requests of their children for something by buying food they shouldn't be eating? I cannot afford to buy shoes he wants, but I can buy him a Diet Coke and a box of sugar-laden cereal. Have you run into that kind of thing?
Well, that's self-evident that a lot of that happened. And, that's something I as a person can understand, because I wasn't trained that way, and I didn't train my children that way. I tried to get them to eat proper. But they're pretty smart. My daughters would stay up late until Charlie and my wife and I went to sleep, and they'd cook what they wanted. So I don't know. But it wasn't a hamburger from McDonald's. But right now, I think the incentive is the fast food place is just about as expensive as other restaurants. So there could be a change made. That may be an effort, a way we can kind of change that. But we are a product of our subculture or culture. And to change that takes a great deal of effort.
Okay, that was a question.
Thank you.
Thank you.
I can sit down now?
Okay, who wants to get up and say their piece?
I'll go. Pardon me.
Well, I guess I'll do it.
You're next up.
Well, personally, I think we're looking at the equation the wrong way. If we applied mathematics to what's going on in the healthcare area, I think you'd find some very interesting algorithms showing up there, where cost is considered. It seems every time we get another benefit program, then all the costs go flying up, and somehow that's just not. That's wrong, and ultimately we're paying for it, and somebody at some level is going away with all that nice extra cash, and so I think we need to completely kind of topsy-turvy the whole system, rethink the entire thing. Because something's not working there. Now, there are different areas of healthcare which are very much separate. For instance, last Wednesday I was playing at a retirement home for the mentally challenged area, and they're behind, they're really confined because you can't let them go out and wander around because they don't know where they are. And so we're there playing old favorites for them. I'm playing the fiddle with some other very talented artists, and having a great time. And you know, that's its own kind of thing there. When I was leaving, the security guard didn't want to let me out. He was joking with me. He was saying, well, you know, we could get you enrolled in here, and you know, you get 3 hots. And I said, 3 hots and a cot? The judge told me I didn't need that. So anyway, that was my joke. But we've got some really specialized areas. I think one thing that could help and promote health for elderly people is, I mean, once you're 65, once you're retired, I think really, I mean, we have some property tax breaks, but I think property tax ought to go to 0. Because that's probably why most elderly people lose their homes, is they just can't get around to paying the property taxes. If you've got medical bills that you're having to address, and then you can't make your property tax, then you lose your home. It's just like this cascading effect. One of the things when the Soviet Union fell apart, the things that really buffered the whole thing is, no matter what you thought of the whole communist system there, they were all stakeholders in their dwelling. So you couldn't kick anybody out of where they lived. And you could have maybe 5 families stacked into a really small area, but everybody had a few amenities. They had water, they had hopefully sewage, you know, things like that. You know, the system begins to fall apart when you know, people are losing those. So our system is completely dysfunctional in my my viewpoint, and the costs are just astronomical. So I think there needs to be some way we can divide it up into different sections. I mean, one other program I thought would be very good is what really keeps elderly folks going. They want to visit their grandkids. How about a program, subsidized program, where you know, you can add a few more carriages onto an Amtrak, and they can be going around the country, taking their time, seeing the country, and visiting all their relatives, all their grandkids and everything, because they're not on a schedule like everybody else is necessarily. And I mean, there are things that can be done to promote health. There are corporations now who are giving discounts, in some cases requiring that their employees be enrolled in and using a health club. I can't emphasize any more than that has been emphasized already here, how much some kind of exercise on a regular basis helps health. There are things, for instance, we're talking about people being overweight, but there's also the muscle factor. The older you get, the more percentage of muscle you have, separate from the whole fat situation, but just the percentage of muscle is such a huge issue in regard to health and longevity. I mean, there are other things where I think in a true enterprise system, the government, if they have any duty at all, perhaps they should be offering basically prize awards for people who can solve and take care of certain challenges that we have health-wise. I mean, I've been hearing for several decades that diabetes has been solved, that there are things you can do to completely reverse type 2 diabetes and put somebody back up, you know what? But then you go out into the marketplace, I don't see those available in the marketplace, whatever it is, whatever's supposed to help. Because we have whole industries built on people being ill, and that's got to change.
because ultimately, each one of us are paying. Okay, who's up next? Go for it.
It's too long and I'm staggering. Well, we've had this discussion more than once, and each time it has a few unique characteristics to it. Most of the time it has a lot of the same characteristics to it. And Calvin and I are perhaps more equipped to discuss it than most people walking down the sidewalk, because we both worked in parts of the industry. He described to you tonight what he did. And I worked in insurance companies. I also had his clients, the providers like Baylor and a number of others. So I've seen it being, the health care being provided, I've seen it being paid for. It's gotten very complicated. I would say that while I don't know everything there is to know about it, if you put a scale up there on the wall of what people know about health care, neither Calvin nor myself are down in the bottom 10%. And I may be not at 95 or 98%, but I'm up there because of what I've done. You know, after leaving working with those companies, I recruited hundreds of healthcare people in the financial jobs, not in the provider. I didn't recruit nurses, I didn't recruit doctors, but I recruited the people who handled the administration of the hospital and other healthcare providers, the people who did the accounting for it, the people who collected the money. One of the highest paid people I ever recruited was for Healthcare Corporation of America or one of those other holding companies of hospitals. Their sole job was to take all of their hospitals and to collect the maximum amount of money from Medicare, Medicaid, and other providers for the services they provided, because it was so extremely complicated that people down there at the hospital level, even if it was a 300-bed hospital, they just flat did not know how to do it. So for those of us that were out on the street as ordinary citizens, we don't understand it. Our Congress does not understand it. I'll say it again. Our Congress does not understand it. They're not stupid, but they lack knowledge. They showed it 2 days this last week. The House of Representatives and the Senate interviewed Mr. Z from California, and he made a fool of them because they do not know enough about how that internet works to ask him intelligent questions and understand his answers. Well, guess what? Healthcare is more complicated than that. One of the things almost nobody does with respect to anything that somebody pays for. In other words, you don't reach in your purse or your pocket and you take out your money and you pay for it. It's paid for by somebody, some plan. That's the most common way that is carried. Here's a simple example of lack of knowledge. When hospitals would send out those bills, and I assure you Calvin has seen some of them that are umpteen pages long, and you read through all of them and you read all the charges and you roll your eyes And you think, how in the world will I ever figure out whether all of those are correct or not? I wasn't there, I wasn't watching them doing that. But the fact is, we've experienced this in America. If people get a detailed bill and they have an opportunity to read it, enough people will question things on that bill that the bills go down. If they have group insurance and then they go buy a supplemental care to pay the other 20%, let's say, they don't ever look at the frapping bills. So the doctor can charge anything the doctor wants to. The hospital or clinic can charge anything they want to. Will they charge too much? Some of them will. They're not all crooks, but some of them are crooked just like the rest of us are. Republicans do not want a national health care bill. And Calvin, I would must say, I can't read their minds, and you may be 100% correct. You know, the facts are, if we want to have a national health care bill where the poorest person on the street gets the same care as the richest lady on University Boulevard and University Park in that $8 million house, then it's not doable under anything we have. We'd have to shut it all off. In fact, we'd have to redo our economy and say to ourselves, healthcare is costing, let's just use an arbitrary number, it's costing 15% of the gross national product. And we're putting in 10%, and it's running 5% in the hole, and the government's reaching in and not telling us and taking that money out of some other tax account that was collected for some other reason and paying those expenses and lying to us by omission. So we have a screwed up mess. So we'd have to stop, totally redo it, start over again. It ain't fixable. It's like buying a 1937 Plymouth with 272,000 miles on it out of the junkyard and saying, I'm going to take that home, make it just as good as new. Yeah, you are. Okay. Oh. I think we've had 3 states. Do you know how many have offered health care to everybody? Oregon is one.
California, probably.
No, they haven't. One's up in New England and one might be Kentucky.
Massachusetts, probably.
Here's the result. Nothing. Zero. Zilch. Nada. They said, oh, people won't go to emergency anymore. They'll go in and see the doctor. No. Emergency room visits didn't go down at all. In other words, people are creatures of habit. We do what we do. We do what we've taught ourselves to do. We do what our parents have taught us to do. And unless somebody totally takes the privilege away from us, we're just going to keep doing it. So there's some things that are hard to get people to change. Okay. When Obamacare was passed, it didn't go in. Here's the deal. The first initial period of that, it collected premiums for 4 or 5 years. It only paid out expenses for 3 years. Ta-da! They could make it sound like it wasn't losing money. 5 years in, 3 years out, ta-da! It didn't lose. Yeah, it was losing money. And I think it was 62% of people were against the bill when it was passed, and they were still against it until they started collecting out of it. And then when they started getting money from an Obamacare plan, they suddenly changed their mind. And that's what he bet on. And he was right. We're greedy, hungry dogs. It's not a very nice way to say it. That's true. It's complex. You can't talk about it in an hour. You could take a semester of college and you wouldn't cover it all. My experience goes back over about 50 years. Do I know it all? Heck no, I don't. But I know a lot. I know enough to know how complex it is. Okay, voters were against it before, voters were against it after. Now they're for it. I have never read a report that shows us what the providers are making that would tell us whether they're making a reasonable return, not enough, or they're ripping us off. I wonder why that is.
Is it ripping us off?
Nobody has the guts to do it, I would guess. They're afraid they'll be not here tomorrow. Working with hospitals, they made a profit. It was not anything excessive. The average doctor in the United States, general practitioner, makes about 160 grand. That's about what an accountant makes, about what an average architect makes, a consulting engineer might make. In other words, it's not excessive. An internist might make 175, 185, have a super practice in a good part of town, they might make 200 grand. The big numbers you read are when somebody's a specialist in some sort of health care and they make $500,000, $600,000, $700,000. Is that right? I just don't know. People will pay them, right? So they charge it. Let's talk about England and Canada. People in England are ignorant about much of health care. The government, and Mr. Beasley can talk about this better than I can, I'm sure. The government doesn't tell them what he gets living in Dallas, Texas, covered under U.S. health care, in terms of services, in terms of fees paid. So they are more happy in their survey than they deserve to be. Canada was close enough to us, they began to discover. Because our people would go up there to buy their cheaper drugs, and they'd tell them stories, and they figured out, aha, this is not working so good. So now they have two plans up in Canada now. One that pays more, one that pays less. Yeah, that story about you can keep your plan. No, you couldn't keep your plan because the plan had to have certain requirements. Obamacare is not a plan for everybody. Obama came and wrote expensive his writers. He didn't do it. The guys that created the plan up in Massachusetts put that together and they created what you would call a Cadillac Lincoln plan. And then they wanted the government to fund it for those who are at the bottom end of the scale who couldn't afford it. The fact is, if you X'd it off tomorrow and everybody had to go out and buy health insurance on an individual basis who's not covered under health care group insurance, they would find something they could afford. I quit my job when I had a not working wife who had none anymore. I had 3 small elementary school age children, and I was very fortunate. I was able to convert my major health care plan, not the regular health care, but just a major, from my group plan to an individual, and I carried it for 9 years until my wife got a job done at Baylor. And we had to pay our initial cost out of pocket. We were pretty careful about what we did. I didn't turn claims in for small amounts. It wasn't worth the paperwork. I might get $5 back, So the point is, individual responsibility creates ethnicity on the part of the user and the buyer. if sugar daddy is paying for it, you're gonna just spend it. You're not gonna be any restrained at all in anything. And the healthcare providers, some of them will take advantage of that. All right, I could talk all night about it. As I said, I could teach a one semester course about it, and it's a very complicated issue. The point I want to leave with you is this, and I know I've taken up 2 or 3 speaker times. It's a complicated issue. We do need to deal with it. We're very fortunate that he knows enough about it to get up and talk about it and tell us a lot of the facts. And I appreciate that, because most people don't, and he does. And would he and I fix things exactly the same way? Some we probably would, and some we probably wouldn't. But that's just fine. That's the way America works, isn't it? That's how it works. So guys, all we can do as citizens of the United States is to listen to what's said about it and try to learn as much about it, so when the issue comes up with our elected representatives in the Congress, we at least have some basis to drop them a note or give them a call and say, hey guys, I want you to support this or that because. And if we know nothing, we won't do that. Thank you. Well, those wires are dangerous, John. Watch them.
I will. Well, actually, since I enjoyed the benefits of National Health Service, I should probably say something about it if you see English system. By the way, in England, the elite are different from the rest of the mob.
Yeah.
And I was one of the rest of the mob. The elite are privately educated. They go to a separate school. Typically, they'll go to Oxford and Cambridge because the founder of that school also founded a college in Oxford and Cambridge. So they live lives apart. They also avail themselves of a private healthcare system. So they go down to Harley Street, Wimpole Street, and of course they get special treatment. So there is a 2-tier system, but that was one of the bargains that Aaron Bevan, who introduced the National Health Service, made with the medical profession. Basically, the specialist doctors can attend the National Health Service patients in hospitals, but they can also have a private practice as well, which is only the very, very rich can afford, but it's there. And so there is a sort of a choice. Now, it turns out that the conservative, as Hank will say, when I talk about the right wing are people who do not like government, interfering in anything. Okay, they rather, and they like privatization of everything. The only problem is, and I think Calvin referred to it, healthcare is a thing that really doesn't amend itself to privatization very well, because you can't have supply and demand, because actually the recipient really, if you read Adam Smith, in an arm's length transaction, the buyer must know as much as the seller, okay, to have a fair transaction. Otherwise, if you don't, and typically the buyer never knows as much as the seller, you have an unfair transaction. And so in the healthcare system, we have a totally unfair transaction. When you go to the doctor, and of course, medical science is not really a science. Okay? I mean, it's, take this and see what happens, and good luck. And because actually, the human, because of DNA, we're all different. And so, I could give somebody, well, if I were a doctor, a medical doctor, I'd give someone a drug that would make them better. It might kill the next person, you just never know. So the whole system really is not apt for measurement, because when you buy a car, you expect it to work for so many miles, right? you don't expect to drive off and collapse into a pile of rubble after 5 minutes. I mean, even Granny would know that. But when Granny goes to the doctor, she's no idea, what he's saying to her and how effective it is, and does this treatment really suit her or not? Even though you are, begged to be informed participants, you never can be. Because I think half the doctors really, the pharmaceuticals industry tell the doctors, they say, well, take this pill and blah, blah, blah. And by the way, you can trial this on your, we'll offer it for free, so you can trial it. So I think the very essence of healthcare is is sort of not amenable, to the private system. It just is. It's not one of those commodities that can be. So here we are in America, paying 17-18% of the whole GDP on healthcare. It's an enormous amount of money, and the results aren't very good. Now, before the Affordable Care Act came along, I think there was something like 55 million Americans without insurance. And after the act, I believe it came down to about 30 million. Still, even after all of that, still without insurance. The National Health Service in England covers everybody, and it costs about 8 to 9% of the GDP. And I know because my wife has been ill, so since I'm an old boy of Imperial, and I have a pretty good medical, I called them up and I said, well, can I speak to someone? And so the head professor of the department called me back. So I said, well, what would you do? And he went through a whole series of things that would happen. You do this, you do a new gene therapy, to see if it's gene related. They do something else, and they do another exam. So I go back and say, okay, well, half of it's not allowed because they won't pay for it. They simply won't pay for it. Even though the doctors would like to do it, they won't pay for it. So basically, you've got this very expensive system that's controlled by insurance companies who actually deny care. They won't pay for it. It happened to me, a few months back. They won't pay for it. Now, so here we are, paying through the nose for a system, and it's expensive. Every time you go to a doctor's office or a dentist's office, there's about 2 or 3 girls there. Look at, oh well, what insurance have you got? It's a paperwork mess. And the other thing, of course, this really goes back to what sort of a society you want. The problem with the whole system today, there was when we were running under Keynesian economics, from after the war until 75, there was a theory we should have full employment, and the government should promote, and the Fed should promote systems to create full employment. And certainly in England, in the 50s, the unemployment rate was like 1.5%. Everyone was working, all going to factories, and it was humming. And of course that's been broken down since because of China and et cetera. It's gone on. Same here. And so you have this precariat situation. Certainly, I didn't talk last week, I didn't talk a lot about England, but you see it's had this right-wing government which loves to have this whole reserve army of unemployed. It has what it's called zero-hour contracts, whereby you sign up to work for the week with no guaranteed hours at all. So you can be paid, we can work 10 hours, 30 hours, 60 hours, or 0 hours. So guess what? Nobody will, you can't rent because you don't have a fixed set income. You also have the situation of internships, whereby you have to actually, work for free. to get experience to work. You know, so, you know, you've got a whole society, you know, living under this precarious situation. You have a minimum wage, you know, which is nowhere near a living wage. In fact, the ARA, the American Restaurateurs Association, have paid the huge sum of $2.13 an hour. That's they pay to be a waitress. Okay? So that's why, you know, I tend to more because that's what they live on.
Yeah.
That's what they live on. You know, and you know, you have a very, very high stress society. You know, you have you know, and you have teenagers that do stupid things, especially, you know, amongst the more underprivileged, who get drawn into drugs and gangs and so on, and they're marked for life. They're never forgiven. They wreck their lives. And this happens every day of the week, and we have a prison industry that thrives on that, and that's privatized. You know, so, you know, look, you must have a government that does, you know, looks after the good, you know, the public good, which means the whole country. You can't have this leeching off everything, making a maximum profit of everything, because in the end it doesn't work. Because we all, as someone said, we all pay more. So you overpay for healthcare and education and everything else. So again, I'd say look in the mirror, and we need a government that really cares about the people. And we'll have a private healthcare system that works for everyone, and so on.
Okay, go for it, Peter. I always like to tell everybody I'm really conservative before I start. Basically, you know, we're talking about, you know, some people want the government to take care of everything, and some people want it, you know, you want them to be you're on your own. For me, this is sort of like trying to decide who's going to beat up mom. You know, we have from my point of view, just a broken healthcare system. So before we even start talking about who's going to pay for it, I mean, there's certain things we can do to fix this system to a certain extent. So I just like to point out some things. And again, I think my favorite expression, the people lying to me are different than the people lying to you. So the people lying to me are telling me this. First of all, the three big cancers, I think colon cancer, breast cancer, lung cancer, they haven't made any improvements in 25 years. Basically, you're going to, whatever the percentage of survival was 25, 30 years ago, it is today. They have made progress in childhood cancers. I also told you about, you know, from Ms. Daniels, she pointed out that this one demographic of Mexican immigrants coming into the country who have no access to health care are living 8 years longer than the people who have access to our doctors. And from several sources I learned, not just from one, but a few, that the third leading cause of death in this country is medical errors. It actually has a name. So if you said the name, if you read it, you might not know what it was, but it's just a medical goof-ups. So I don't know what the percentage of people are on drugs is, just like, and how now everybody's on crazy pills as well. They pass those out like candy. So you know, we don't have a healthy system. It's very expensive, and and it's just broken from my point of view. Now, just to get through this quickly, this is called allopathic medicine. If you get sick, they treat the symptom. So I got involved. I had headaches. I had certain problems, and I read somewhere about iodine. You know, and I had all the symptoms. So I started taking iodine, and my headaches went away. Wow, you know. And then I read about iodine, and they say, you know, just about everybody in America is lacking in it. The Chinese get the Japanese get 100 times more than us. and they don't have all these different medical problems, and it seemed to work wonders for me, so I did it, and I feel much better. And I asked my doctor about it, never heard of it. But if you go to the old medical journals, the old before allopathic medicine, they would give you iodine if they didn't know what was going on. If they didn't know what was wrong with you, that was the first thing they'd give you. And then I found out about, what was the other one? Oh, so then I find out about K2. You know, K2 is a vitamin. I saw my doctor yesterday in the drive-thru at Home Depot, and I said to him, you know, did you look at the K2? Basically, K2 is in order to have healthy bones, you have to have calcium. In order to absorb it, you need D3. In order for it to go to the right place, and that means the calcium would go to your bone and not your arteries, you need this vitamin K2. And it's an old medicine too. This old doctor, I forget what it was, would recommend this stuff because populations, he went out and looked out. But anyway, my doctor didn't know about the iodine, he didn't know about the K2. And then there's B17, which is, you know, I forget the name. Laetrile. And if you read the studies on that, you know, but any event, I'm just saying there's this old medicine that has been pushed out, and doctors really are barely doctors anymore. What they can do is they can do what is standard medical care, and if they go outside of that, bingo, they can lose their license, they can be sued. They can be sued if they have success with it, because if you're outside that line, or what the chemical companies tell you can do, you can get sued. So, from my point of view, you know, before we even have this discussion, who's going to pay, we need a medical system that works, and I don't think ours does.
It's cold again.
You want your health care, you can keep your health care. You want your global warming, you can keep your global warming. Oh boy, you know, it's really actually normal, this weather for Stalingrad, St. Petersburg, for this time of year. They got me all hot and bothered. Well, Dinesh Souza is, right?
Yeah, I do.
Anyway, he was saying he had a friend that was trying to get into America for 10 years. He couldn't get in. He kept applying and applying. He said, why are you trying so hard to get in here? He says, I want to go someplace where the poor people are fat. So, thank God for our blessings. Yeah. Well, surely cannot quibble on details with Calvin or Jim, but philosophically, there is a question, maybe this is moot because it's so big, about what's the best way to do this, because there's a lot of corruption. The price of the health care, which I don't like to use that word health care, I call it sickness in management, is the main thing. You actually mentioned that. The main thing is the price. It's not in line with what it should be. The thing that lines things up, I think we should try the free market. Does that mean rampant crony capitalism? Probably not. So we've had that. What we have is a corrupt system. The price of these pills and these procedures is not in line with a free market system. I think that's our best way to correct this. And you can see it in the exaggerated form in the healthcare system as well as the university system. When they started subsidizing the universities, the prices went way up. I went to Ivy League school, had room and board, $3,000 a year, $3,400, I still remember. And now that, you can't get one day of that. And it's watered down. If I didn't get a degree, but if I did, it would be worth a whole lot more than it would be today because they watered down the college thing. And the same with the healthcare. People say our healthcare is bad for the money we pay, and that's right. It's corruption, really. So getting more government involved is one approach, and I gotta take a little poll here. Who loves Republicans here?
Who loves Republicans?
Sometimes.
We got one.
Sometimes.
Sometimes.
We have three and 3.75, more than I thought. They said sometimes.
I vote for the best candidate. Screw the party.
Well, who loves Democrats? Who thinks they have a duty to push the Democratic Party line? 1, 2. Buckle my shoe.
We're not very confessional tonight.
Hey, I think there's a third group.
Independent.
The aliens. Who loves aliens?
Who can't in good conscience vote either way?
No, so we've got a non-voter. Well, we should have more non-voters. I was ranting on to this lady at the market today. She, I was at the Earth Fest open market today. It was freezing. They've been there for 7 o'clock in the morning. It really tough for them. And I started ranting on about how I'm going to Berlin, where political correctness is out of hand, and they can arrest you for even thought crimes now. The home of fascism is alive in a different guise now. It's just they just completely reversed the targets. Anyway, so I was talking to her and said, well, I kept everything saying, do you hear about this? Do you hear about that? Real big news. I mean, no, I never heard about that. I never heard about that. I don't listen to the news. I stay away from anything to do with news. And I thought to myself afterwards, I know a lot of women like that. Maybe we should take the vote away from the women again. So anyway, well, aside from that, aside from classifying people by identitarianism, which I hate what's going on now, I don't want to be identified as white, Hungarian, born in another. I mean, that's usually not the relevant factor. And for people to want to be black, want to be women, want to be transgender, I think it's a real sucker punch. They're going down. But as far as if you don't want to know the news, should you be allowed to vote? I mean, really, all you're doing is selling your vote. It's going to be like, well, whoever's going to make me feel good, or put my money in my pocket, or whatever like that. It's totally not the way this system would work. So democracy is not going to work this way. Now I'm going really far afield. But philosophically, I am. You're right. Thinking we should give free market a chance, and that's not this corner capitalism. We got the lobbyists, which I think should be outlawed. We got systems that are out of hand. But let's start with the price of the most outrageous ripoff of all, this healthcare system, and work back from that. And good luck, America.
I wrote something down this time so I don't forget. Well, there's so many scams out there in the healthcare business. I mean, chemo. How many doctors actually prescribe chemotherapy for their family? You know that they wouldn't do such a thing. But anyway, years ago I sold herbs, and I think there's something called Cheyenne, Podarco. There are various herbs that absorb cancer cells in the body. And of course, if we took baking soda, every day, that also neutralizes acid in our body. You mentioned K2. I bought some the other day because within a month it's supposed to clean out your arteries, I was told. I don't know, I don't take things faithfully like I should.
Calcium to the right,
Yeah.
it distributes the calcium to the right part of your body.
Right. I know there's so much money in healthcare. My son-in-law at one time made $50,000 in 1 month. He's overly concerned about money. He still thinks he's going to die poor. I can't imagine why. But anyway, iodine, that's a wonderful thing to take. Maybe that would help the obesity problem in our country. It really would. And anybody living in California, I know people that don't buy California wines now because of the Fukushima incident with all the fish there. My gosh, you're really taking a chance eating some fish, And tilapia, people ordered all. I don't know if there's any clean tilapia. Is there, John?
Hope
Yeah.
so.
Well, I don't know. If you go online and look up fish coming from, and shrimp from some foreign countries, and they won't even tell you where they get it at Papado's, so I won't eat their shrimp or tilapia.
And the worst thing is that
It comes from terribly dirty waters, very contaminated.
fluoride will fill your body up
Yeah.
where iodine's supposed to be.
But I know myself, when I was in the hospital, when I had tachycardia, my heart would race 230 times a minute. They wanted to give me an x-ray for my chest, they wanted to do this, they wanted to do that. The bill was like $400 or more than that. It was just ridiculous. I finally told them, I think I've had too many chest x-rays, I don't need another chest x-ray. But my idea is first to go to maybe an acupuncturist, something natural, see if that helps and it balances your body. You know, the Orientals take the pulse from 2 places on the wrist and they see if you have balance in your body. You want to have balance, so we should all do stretching every day. Stretching your spine is extremely good for you. And just walking, you know, stimulates your brain and all. But we need to move around and not be too close to the television set, right?
Well, this is truly a huge subject when you start talking about health and the providing of health care. I know back in the 80s, I had friends who made a presentation to I think the guy was director of Health South at that time. Later on, a couple of decades later, he got prosecuted for some kind of embezzlement, which made some people happy. But back then, they were conducting a test, and my friends had a device some might recognize. It was pioneered back in the 30s by Royal Raymond Rife. And these folks at a hospital here locally were, you know, they were sure it wasn't going to work. But, you know, anyway, the test was of a petri dish, and they had one of these, well, there are different ways of applying Rife frequencies. This was more of a kind of a beam broadcast type thing. Well, they not only killed the bacteria in a petri dish, they cleaned an entire surgical room. Health South was freaking out over how thoroughly well that worked. The Rife frequencies. But then within about 72 hours, they had figured out that they were going to be freeing up a whole bunch of hospital beds if they started using this device. And all of a sudden, the hunt for a cure broke back the other way, and I had friends who had to go underground to stay alive and existed for, I don't know, 6-7 years just trying to stay out of any kind of reporting so that they couldn't be tracked and knocked off because of what they had done there in that test at Health South. So we have a level of criminality in the area of healthcare which is incredible. One of my good friends who's passed on now wrote a book called Politics and Healing. He was a former New York assemblyman, which is their form of congressman, and his name was Daniel Haley, and he wrote about 10 instances of cancer cures that were opposed and cratered by the system. And he documented the doctors who, you know, took on incredible cases, stage 4 cancer cases, people who'd been given up and cured very high rates, 70% plus, 90% in some cases, using different techniques. And all those techniques have been suppressed. So, I mean, you know, where are we here? You're paying for not only a dysfunctional system, an inefficient system, a poorly constructed system, but you're paying for a criminal system, and you're supporting a criminal system, which is actually suppressing human health along the way to doing its job. So, you know, this is the thing about government. you can look on one side of things and government is beneficial and it's doing all this good work, and you look on the other side and there's all these horrible things going on that government has some purview over. So it's kind of this Jekyll-Hyde thing, where you got this dual personality. There, in some cases, I was promoting Ron Paul back when Ron Paul was running, and was hoping, but I mean it was against hope because Ron Paul was just too honest a guy and too little of a politician. They called him Dr. No. If it wasn't constitutional, he wouldn't vote for it. And that was his principle. But if Ron Paul were asked about the question of health care, I'm sure he would say it's not a federal matter, it's a matter for the states. And I think that that's a good place to start dealing with it, and have the states compete and see what they can do, how they can contract out, what kind of enterprising system they can bring in to compete with each other. But I really, really strongly urge that we get the federal out of the health care. And just to kind of inform you what's going on, we've got things kicking up in the Middle East and some very bad mojo going on there. At the same time that in a school system, it seems to me like it was Michigan, I could be wrong, but they were having these emergency vaccination drills where they were having the students drill to receive these emergency, like outbreak vaccines, and that law enforcement was going to be present for these drills. And it kind of reminds you of Jim Jones and the Kool-Aid, I'm sorry. I mean, get everybody conditioned, get that vaccine. I'm not going to be lining up to get that vaccine post.
This won't take long. I enjoyed all the comments that you made. Some I agree with, some I don't. I know the state rights argument is very old, but if the federal government's involved in Medicare and Medicaid is the only reason the states, particularly the South, has anything to do with health. And even in preventive service, immunization, which some people are opposed to, is the same thing. I know what John said, medicine is practiced by a physician, for the most part, is an art, not a science. They use the tests, the MRIs and things like that, and to help them prescribe and diagnose. But one thing is, we need as a people to have a little bit more knowledge about what's going on, and that should be taught in the schools and in the homes. Because if you go to the doctor and you can't tell them what's hurting you, what you get may not be what you need, because they may not have a lab test to tell them that. And it's particularly true in mental health. If you don't know alcoholism, if you don't know what causes it, you can't help it. And as many as Plato and as Aristotle say, if you're going to have a representative democracy, the people have to be fairly educated. They have to be able to think for themselves and demand factual information. And we don't do that in the United States. I don't see government as a problem in a lot of cases, but it's some things the government needs to do that it doesn't do. And I was taking a course some years ago, and it said, is the welfare program that expensive to the nation? But the tax cut that the corporations get, the rich people get, is just about is a larger drain than what we pay spending for support to people with children. We need to train people and empower people to work, and we aren't doing this. For so long, certain people, we didn't want them to learn nothing. We wanted them to be ignorant. And now that's pretty dominant among people who shouldn't be. But if we don't get the education, we don't get the training, we don't learn to think objectively, don't learn to be so greedy and just look at self. That's our real problem. Thank you.